Hello, Clinic Review family. It's Dr. Sharon. I'm going to continue today, just kind of working my way through the Nclex test plan. Today, I'm going to be working on safety and infection control. This is not comprehensive. All I'm doing is bringing up the Nclex test plan, looking at some of the topics and writing questions to go along with them. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. You know that this channel is home of the Clinic Review organization, and we offer the very best Nclex review in the entire universe, in my opinion. And Mark Klimek is the GOAT of Nclex reviews. I honestly don't know of anybody in the country who knows more about preparing for Nclex than he does. He has a unique gift in that. He has a 21 plus hour Nclex prep program that you can get online on demand. You can also see him in person if you really want to come to Ohio and see him in person. He does a 3-day review, which is the same as the 21 plus hour Nclex prep online. We also have a streaming service and small group tutoring. We do Next Gen as part of the small group tutoring. I do teach as part of that. So if you want to meet me over Zoom, you can do part of our small group tutoring and sign up for that at Clinic Reviews. So what I've been doing is I've been looking at the Nclex test plan and trying to write questions that go along with that. And they're not the most complicated questions in the world. In fact, if you look at the Nclex test plan, what you realize is these topics are very, very fundamental. And I think one of the mistakes that people make when they study for the Nclex is they prepare all the very complicated pathophysiologies. They know all about some really complicated things, and they forget to study the fundamentals. So what I'm really doing is focusing on the fundamentals. And what I'm wanting you to see is that you have to use common sense and clinical reasoning when you're doing the fundamentals. You have to think, generally speaking, what do we do for this problem? And don't overthink it. Okay, that's a key thing, is you can't overthink it. You have to say, what makes the most sense here? And think generally. A client with a known severe latex allergy is scheduled for surgery. Which action by the nurse is most important? So this is a best question. You say, if I can only do one thing, what's the one thing that I have to do? Label the chart and room with latex allergy. Schedule surgery as the first case of the day. Place latex-free gloves in the operating room. Administer prophylactic diphenhydramine 30 minutes before surgery. All right, most important. So I'm going to cross off B. That doesn't schedule surgery as the first case of the day. That doesn't seem to really be applicable in this case. Maybe in some ways it could be, but not so much. I like A. We need to label them as latex allergy. I certainly like C. Place latex-free gloves in the operating room. Administer prophylactic diphenhydramine 30 minutes before surgery. We might do that. It doesn't seem to be the most important thing compared to the others. So I'm going to go ahead and cross off D. Now, a lot of people say I get down to 2 and I don't know how to pick between those 2. So what you do with a best question and a nursing action, best nursing action, is you say, well, I can only do one. So if I do A and don't do C, or I do C and don't do A. So I'm going to label the chart and the room as latex allergy, but I'm not going to put latex-free gloves in the operating room. Okay, I'd love to have latex-free gloves in the operating room. Place latex-free gloves in the operating room, but don't label the chart and room with latex allergy. Okay, I have to label the chart and the room with latex allergy. If all I do, so A is the correct answer. So if all I do is place latex-free gloves in the operating room, but I don't label it as a latex allergy, there's lots of other things in an operating room that could be have latex in them. I have to label the chart and the room as latex allergy. So again, remember, we're talking about a best question. What do you do if you can only do one thing? Which one do you have to do? When you get a best question, you realize you have to understand there's going to be more than one thing that you're going to want to do. You're going to want to do more than one thing. Best questions are always hypothetical or theoretical. There's never a time in real life you can only do one thing. Okay, never. But on a test, you have to say, if I could only do one thing, which one thing do I have to do? What you're showing the National Council of State Boards of Nursing is, I know what's most important in this case. Which intervention best protects a client confined to bed from developing skin breakdown? So it says best. It doesn't say nursing action, but it's probably a nursing action. Reposition the client every 4 hours. Apply a donut-shaped foam cushion. massage reddened areas vigorously, use pressure relieving mattress overlay. Okay, best protects client confined to bed from developing skin breakdown. So I know you have to reposition the client every 2 hours, not every 4 hours. So I'm going to cross off A. And I know you're never supposed to massage reddened areas. So I'm going to cross off C. So I like B and D. So I'm going to say, I can say I'm going to do one, but not do the other one. But I want to compare it to what the question is asking. I'm going to apply a donut-shaped foam cushion to prevent skin breakdown. Apply a donut-shaped foam cushion to prevent skin breakdown. Well, that's going to prevent skin breakdown in one area, like the coccyx. Okay. Or I'm going to use a pressure relieving mattress overlay to prevent skin breakdown. So D is a better general action. I mean, I could say I'm going to apply a donut-shaped foam cushion, but not use a pressure relieving mattress, or I'm going to use a pressure relieving mattress, but not apply donut-shaped foam cushion. That still tells you D is the better answer. But I just want you to understand you can also directly relate it back to the question itself. And you kind of go, okay, one is just a better general intervention than another one. When lifting a heavy object from the client's bedside table, which body mechanics principle should the nurse use? Keep the feet close together, bend at the waist, keeping legs straight, use the larger muscles of the legs and buttocks, avoid lifting objects over their head. Okay, when lifting a heavy object from the client's bedside table. Well, I'm not going to keep my feet close together. That's out. And I'm not going to bend at the waist. That's out. Okay, so those two are out. So I'm going to use larger muscles of the legs and buttocks, but not avoid lifting objects over my head. Or I'm going to avoid lifting objects over my head, but I'm not going to use larger muscles of the legs and buttocks, which means I'm going to use my back. So I don't know if I need to lift it over my head. I certainly want to avoid lifting it over my head if I can, but I can't use my back. It's a heavy object. If I use my back, I'm going to strain my back. I have to use my legs and the muscles of my legs and my buttocks. So I have to do C. So there's more than one thing that I would like to do, but I have to do C. A client recovering from total hip arthroplasty is being discharged home. Which instruction most promotes safety? Sleep on the non-operative side, use a high-seated toilet at home, cross your legs when seated, bend at the hip more than 90 degrees when dressing. So arthroplasty is hip surgery. So the key things I know about hip surgery is you want to keep your legs abducted. Abducted means separated, and you don't want to sit at a 90-degree angle for too long. So these are temporary restrictions, like these are 6-week restrictions, but we're just sending them home. So I'm going to keep with those restrictions. So if they sleep on the non-operative side, even if they sleep on their side, unless they have a pillow between their legs are going to come together. So, I mean, I guess they can. I don't love A though. They'd have to keep an adduction pillow between their legs if they're going to sleep on their non-operative side. Use a high-seated toilet at home. That's good because that prevents them from flexing too much their hip. Cross your legs when seated. That's absolutely out. Bend at the hip more than 90 degrees when dressing. That's out. So really, it's only between A and B, and C. A isn't specific enough. Like, I don't want them laying on their incision, but they have to keep an abductor pillow between their legs. So they need to use a high-seated toilet at home. That prevents that flexion of their hip. During dressing change for a draining wound, which action best breaks the chain of infection? Dressing change for a draining wound breaks the chain of infection. Donning sterile gloves to remove the soiled dressing, placing the soiled dressing into a paper bag, cleaning from the least to the most soiled area, performing hand hygiene before and after glove use. Breaks the chain of infection. So let's see if these break the chain of infection. Donning sterile gloves to remove the soiled dressing breaks the chain of infection. Well, you should wear gloves. I don't know that you have to wear sterile gloves. And I don't like to pick answers that go farther than I have to. The Nclex doesn't reward us for going farther than we have to. Like, we have a tendency to go, oh, well, I have to wear gloves, so I might as well wear sterile gloves. But they don't reward you for that. You just need to know you have to wear gloves. So I don't love A. Placing a soiled dressing into a paper bag breaks the chain of infection. That's actually not true because a paper bag can get soiled and then it's contaminated. Cleaning from the least to the most soiled breaks the chain of infection. Breaks the chain of infection? Well, it does prevent least to most soiled. I guess it does prevent taking the soiled area into the least area. So, okay, C is all right. Performing hand hygiene before and after glove use breaks the chain of infection. Absolutely, it does. So let's cross off A and B. So C compared to D. I'm going to clean from the least to the most soiled, but I'm not going to perform hand hygiene. Or I'm going to perform hand hygiene, but not clean from the least to the most soiled. Well, I have to use hand hygiene. I have to. This is a question of saying, do you know washing your hands is the best way to prevent spread of infection or to break the chain of infection? And if I said to you, what's the best way to prevent the spread of infection? Everybody would say, wash your hands. But they don't make it that easy. They make a question like this, where there's another answer that you also like C, I like that. But you have to say, what's the absolutely best? And you have to know how to figure that out. A client with C. difficile associated diarrhea has been placed on contact precautions. Okay, good. That's what they're supposed to be on. Which nurse action is most appropriate? Wear gloves and gown when caring for the client. Don a mask before entering the room. Use an alcohol-based hand rub on exiting. Keep the door closed at all times. So contact precautions requires gown and gloves. So A is good. It does not require a mask. So B is out. You have to wash your hands with soap and water with C. diff. So C is out, and the door does not have to be kept shut because contact precautions is contact. It's not spread in the air. So A is the only one that makes any sense here. Which statement by a newly admitted client with TB indicates understanding of airborne precautions? I will wear a surgical mask when out of my room. Visitors must keep 3 feet away from my bed. My room door must remain open, or staff must wear gloves and gown to enter. So airborne precautions is a special filter mask. It has to be in a negative pressure room, and they have to keep the door shut at all times. And the client has to wear a surgical mask when they leave the room. So A is true. The client has to wear surgical mask. We have to wear special filter masks when we go in the room, but they have to wear a surgical mask when they leave the room. So A is true. Visitors do not have to keep 3 feet away from the bed. They just have to wear a HEPA filter mask when they go in. Room door must remain open. No, it has to remain closed. Staff must wear gloves and gown to enter. Again, we're not rewarded for doing more than we have to do. In airborne only, you don't have to wear gloves and gown to enter the room. Okay, you don't have to. That's not what airborne is. And we're not rewarded for doing more than we have to. They do have to wear a surgical mask when outside the room. That's required. That's not more than what they have to do. A nurse is educating a client on home fire safety. Which instruction has the highest priority? Test smoke alarms monthly, keep a fire extinguisher in the kitchen, plan and practice an escape route, store flammable liquids away from heat sources. So this is a really typical prioritization question. You have to figure out what's best. Highest priority means best. It doesn't mean first. Okay, if it's first, it'll say first. Highest priority means best, which means I can only do one thing. Well, I do want to test smoke alarms monthly. I do want to keep a fire extinguisher in the kitchen. I do want to plan and practice an escape route. And I do want to store flammable liquids away from heat sources. So how am I supposed to figure out which one is most important? Well, we're going to have to compare 2 at a time. Test smoke alarms monthly, but don't keep a fire extinguisher in the kitchen, or keep a fire extinguisher in the kitchen, but don't test smoke alarms monthly. I'm going to go with test smoke alarms monthly. I would think that early alarm is important. Just seems to me like A seems more important. Test smoke alarms monthly, but don't plan and practice an escape route. So the smoke alarm goes off, but I don't know how to get out of the house. Or plan and practice an escape route, but don't test the smoke alarms monthly. So the smoke alarm may not go off, but I do know how to get out of the house in case of a fire. Well, it seems like in order to save lives, it seems like I have to know how to get out of the house. Seems like I have to. So I'm going to cross off A and go with C. Plan and practice an escape route, but don't store flammable liquids away from heat sources. So flammable liquids are close to heat sources. That's not good. But at least I know how to get out of the house if a fire starts, or store flammable liquids away from heat sources, but don't plan and practice an escape route. So I keep my flammable liquids protected, but I don't know how to get out of the house in case a fire starts. And there's lots of other ways fires can start. So I have to know, my family and I have to know how to get out of the house. So that's how you figure out a best question, y'all. I'm really giving away some serious testing secrets here, and I'm not going to probably do it a lot more. This is going to be one of the only videos where I do this. It's not easy to do. It's not easy to figure out, especially when you have 4 good answers. It's not easy to figure out which one is best, but I just gave you the secret of how to do that. And it takes quite a bit of practice to figure that out. A client reports a new rash after starting an antibiotic. Which nursing action is most essential? New rash after starting an antibiotic, most essential action, best action. I can only do one thing. Document the finding in the client record. Notify the healthcare provider immediately. Continue the antibiotic and observe closely or assess the airway. All right, a new rash after starting an antibiotic. So I'm concerned about an allergic reaction. Okay, I'm concerned about an allergic reaction. So I'm not going to do A and I'm not going to do C. Document the finding is not what I'm going to do if there's an allergic reaction. Just to continue to observe, continue to give the antibiotic. If they're having an allergic reaction, no. So I would notify the healthcare provider immediately, but not assess the airway, or assess the airway, but not notify the healthcare provider immediately. So in some ways, it's sort of a first question, even though, so it's most essential, but it's acting like a first question, which is unfortunate because I would have to assess the airway. They have a rash. Okay. They have a rash. It's not, there's no evidence they're having an anaphylactic reaction in the question. The question doesn't tell me that. And it says notify the healthcare provider immediately. Well, I don't have to do it immediately. I have to assess the airway. So let's do it this way. I'm going to notify the healthcare provider immediately, but not assess the airway, or I'm going to assess the airway, but not notify the healthcare provider immediately, which means I can still notify the healthcare provider, just not immediately. The word immediately is what makes D the right answer. Okay, because I would want to stop the medication and notify the healthcare provider. I want to do that if they're having an allergic reaction, but I don't have to notify the healthcare provider immediately. I have to assess the airway to see what's going on. Okay, so that's what I have to do. So remember, the right answer is the right answer because of the other answers. Actually, the most essential action is probably to stop the antibiotic, but I don't have that as an option. So what I have to do is look at the answers that I have as options and say, what is most essential based on what I know, which is all I know is they have a rash. I don't know anything else. So I have to assess the airway to see if it's causing airway obstruction. A hospitalized client with neutropenia requires protective reverse isolation. It's actually called neutropenic precautions now. Which room setup is correct? Negative pressure airflow with HEPA filtration, private room with positive pressure airflow, room with contact precaution signage only, open shared room with standard precautions. So neutropenic precautions are to protect the patient from us. Okay. So C is out because we're doing neutropenic, not contact. They're different. And standard precautions is out. We're doing neutropenic. Okay. We're going to do standard as well, but it's not just standard, right? So we have to cross off C and D. So do we do negative pressure? Because negative pressure is what's part of airborne. So what's positive pressure? Negative pressure is where air is actually pulled into the room. So that, because what you don't want, if someone has airborne precautions, it means whatever they have as an infection can get caught on air currents and circulate all over the hospital, which we don't want to happen. So we pull air into the room and then it goes outside. Okay. Air in and then it goes outside. The door is kept shut. So none of the air in their room can go to other patients' rooms. Positive pressure is actually where the pressure in the room is higher than the pressure outside the room. So air is actually pushed out so that nobody else's germs can get in the room. And so because we don't do positive pressure if the person in the room is highly infectious, okay, but they're neutropenic, which means they have a low white count. They're highly prone to infection. So we're going to push air out of the room. So positive pressure airflow is actually what we want. And I just wanted to make sure that you know that. A client with hemophilia, which is a bleeding disease, visits the clinic. Which intervention best prevents bleeding complications? Well, I guess it tells you what hemophilia is. Draw blood using a small gauge needle. Apply ice to the venipuncture site for 1 hour. Hold pressure to the site for 10 minutes. Encourage the client to elevate the arm after the venipuncture. Best, this is another best question, y'all. This is don't tell anybody how good this video is, because This is a secret between you, Clinic Review family, and Clinic Reviews, okay? This is how you answer best questions. I like A, you should use a small gauge needle. We don't apply ice for an hour. We just don't do that. Don't pick that answer, go, that sounds good. We don't do that, come on. Hold pressure, yes. Encourage the client to elevate the arm. That's fine, but it doesn't seem best, right? So I'm going to go between A and C. Draw blood using a small gauge needle or hold pressure for 10 minutes. So I'm going to say, well, I would use a small gauge needle, but not hold pressure for 10 minutes. I'm assuming it would be less than 10 minutes. Or I would hold pressure for 10 minutes, but use a large gauge needle. Okay, do you know what the best way to stop bleeding is? Do you know? Pressure. That's what this question is testing you. This question is saying, do you know the best way to stop bleeding? And the best way to stop bleeding is pressure. And 10 minutes is kind of considered the standard of care for blood draws. If your client is at risk, like if they're on Coumadin or anything like that, whether hemophilia, Coumadin, pressure for 10 minutes is considered the standard of care. I have done it for less than 10 minutes. I don't know if it was accidentally or if I didn't know the patient was taking Coumadin, but I removed their IV. I applied pressure for like 3 or 4 minutes. I probably thought it was a long time. And this was a long time ago. And then I put a Band-Aid on it and they walked out, they're walking down the hall with blood running down their arm. And I was like, wait a minute, we got to put more pressure on that. So I learned my lesson a long time ago about putting pressure on venipuncture sites when the person's at risk for bleeding. So to me, C seems a little more obvious just because I've had that experience. But for a new grad who hasn't had as much experience, the National Council wants to know, hey, do you know you have to hold pressure to stop bleeding? Which workstation setup demonstrates correct ergonomic principles for charting? Keyboard at waist level, monitor 20 degrees below eye level. So my eyes are down. Chair height allowing feet flat, elbows at 90 degrees. Feet flat, elbows at 90 degrees. Mouse positioned across the desk for greater reach. No. Leaning forward to view the screen clearly. No. So I'm crossing off C and D. So keyboard at waist level. Do I keep my keyboard at waist level? Maybe, but B is really the same because elbows at 90 degrees. So would it be better to keep it at waist level, or because maybe your elbows are above your waist? Everybody's elbows are a little bit higher or lower. So if your elbows are at your waist, that sounds good, but you want your elbows to be at a 90-degree angle, right? And the chair height should have feet flat. Do we want the monitor 20 degrees below eye level? It seems like it would be best if it was at eye level. So I'm going to go with B. So that is the correct answer. So if you get a question like this, and you definitely can, because this is part of safe practice, including standards of practice and how you do your work, bending, lifting, sitting, and that kind of thing. Use your common sense. If you're like, I haven't seen those words before, use your common sense, think it through, kind of act it out if you have to, and figure out what the right answer is. A client with Alzheimer's disease is restless and attempts to climb over bed rails. Which safety measure is best? If I can only do one thing, what do I have to do? Apply a vest restraint, increase the bed rail height, turn off the bed exit alarm, lower the bed to its lowest position. Well, I thought this was going to be harder than that, because applying a vest restraint is never best. Okay. Applying a restraint is never best. Don't ever look at that as best. If they're asking you specifically about restraints, then you can answer it that way, but it's never best to do that. And we can't increase the bed rail height, and don't turn off the bed exit alarm. So obviously lowering the bed to its lowest position is best in this case. And you might say, well, I've put vest restraints on people before for climbing out of bed. Look, I'm not telling you how to be a nurse. I'm teaching you how to pass a test. That's what I'm doing. In instructing a client on puncture wound care, which statement shows the nurse's teaching is effective? I will soak the wound in warm water twice daily. I will cover the wound with an airtight dressing. I will check for redness, swelling, or drainage. I will leave the wound open to air at all times. Puncture wound care. Soak the wound in warm water twice daily. No, it's just going to soften it up. It's never going to heal if you do that. Cover the wound with an airtight dressing. Right? Airtight, like occlusive. You don't have to do that. You can, but you don't have to. Remember, we're not rewarded for doing more than we have to do. I will check for redness, swelling, or drainage. That's good. Yeah, that's a good thing to do. Leave the wound open to air at all times. You don't have to do that. Again, we're not rewarded for doing more than we have to, but checking for redness, swelling, and drainage is appropriate. So that's effective. That tells me that they understood what I was teaching them. A child with varicella chickenpox is admitted. Which precautions should the nurse implement? Airborne in contact, droplet, protective, isolation, which is neutropenic precautions, or standard precautions. So chickenpox is airborne plus contact, if you don't know that. All right. That's it. This is a highly secretive video. Don't tell anybody about it. I hope you're able to see how really important this video actually is. Okay. So I think that's it. Thank you for being a part of the Clinic Review family, and I'll see you later.